Hey guys, so today we'll be starting with your topic liver cirrhosis. All right. So what does this term cirrhosis mean? Yeah. So to start with its definition, this is a pathological disorder. All right. It's a pathological disorder which is characterized by these following features. So there are four features. All right. We need to know. So the first one is there is necrosis of your hepatocytes. All right. Second is loss of the lobular architecture. And third, there is fibrosis. And lastly, there are formation of your regenerating nodules. All right. So your cirrhosis is a pathological disorder which is characterized by these following features. All right. Now, coming to the classification for your cirrhosis. All right. Uh, yes. So cirrhosis can be classified based on two things. There is your etiological classification, all right, depending upon the causative features, and then there is your morphological classification. Now, coming to your etiological classification, first there's your alcoholic cirrhosis, all right. Second, we have your post hepatitis cirrhosis. Then we have your biliary cirrhosis. Then there's your cirrhosis due to any metabolic disorder, all right. Example, Wilson's disease. Yes. Fifth, there is your Indian childhood cirrhosis. Sixth, there is your cardiac cirrhosis. And lastly, we have your cryptogenic cirrhosis. All right. So these were a few 7 etiological cirrhosis. There are more. You can note them down. Yeah. From your textbooks. So coming to morphological cirrhosis. So these cirrhosis are based on the morphological features, that is the gross features. All right. And that will be concerning with your nodules. So they are micronodular cirrhosis and your macronodular cirrhosis. All right. So let's study what are these two cirrhosis. So in your micronodular cirrhosis, the size of the regenerating nodules is less than 3 mm. All right. Whereas in your macronodular cirrhosis, the size varies and it's above your 3 millimeter. All right. Coming to their etiologies, where do we see your micronodular and macronodular? Uh, Micronodular cirrhosis is seen in your alcoholic cirrhosis, Wilson's disease, and any nutritional deficiencies. Okay, so these are the three etiology for your micronodular cirrhosis. Coming to your macronodular cirrhosis, we see them in conditions which are secondary to necrosis of the hepatocytes. All right, secondary to necrosis of the hepatocytes. Yes. Now, so we're done with the definition. We are done with the classification, the two classifications, etiological and morphological. So now let's come to the pathogenesis. All right. So we studied here the the characteristic features for your cirrhosis are necrosis of the hepatocytes, loss of lobular architecture, fibrosis, and regenerating nodules. So these are the 4 points that we need to have in our mind when we're studying the pathogenesis. All right. So what happens initially is that there is inflammation in your liver. All right. And necrosis of the hepatocytes. All right, so this leads to two things. Firstly, there is collapse of the reticulin network. All right, so due to the collapse of this reticulin network, there is loss of the architecture. All right, and this leads to regenerative proliferation of hepatocytes. All right, which then leads to nodule formation. All right, so there was collapse of the reticulin network due to the inflammation and necrosis of hepatocytes. So this led to the loss of architecture. And what does this lead to? Regenerative proliferation of your hepatocytes, which leads to nodule formation. So that was the first thing that was happening, the first heading. Coming to the second heading, what happens is that due to the inflammation, yes, there was release of certain cytokines. All right, now these were your TNF, TGF, and your interleukin 1. All right, and this leads to your hepatic stellate. All right, and because of this, there is transformation. Your hepatocytes transform into your myofibroblast-like cells. All right, and this causes deposition of three things. All right, there's your collagen deposition, then there's your laminin deposition, and your fibronectin deposition. All right, so and these two collectively lead to your cirrhosis. All right, so that was done about the pathogenesis. Coming to the morphological features, let's start with the gross features. All right, what do we see? First, we see that the liver has shrunken. All right, it weighs lesser than your 1 kg. All right, uh, its shape is distorted. All right, thirdly, there are irregular and coarse scars. So the scars are irregular and coarse. All right, fourthly, the nodules. These nodules are varying in size. All right, now fifth, the cut section. All right, so this is a cross diagrammatic representation of your liver cirrhosis. All right, we see the nodules, the regenerative nodules, and they are varying in size. All right, you could also just draw one diagram and list out all these features, that the liver has shrunken, it has a distorted shape, as you can see here. There are scars which are irregular and coarse, and nodules of varying size. The cut surface shows nodules with intervening fibrous septa. All right, coming to the microscopic features, uh, you see these following things. The first thing you see is that there is your loss of lobular architecture. All right. Second, you see the regenerative nodules. All right, and these regenerative nodules contain the hepatocytes. All right. Thirdly, what we see is the intervenous fibrous septa separating the nodules. So the intervenous fibrous septa, all right, that separates these nodules. All right, so those are the microscopic features. Now let's come to the investigations. All right, now The investigations are very important for this particular topic for your liver cirrhosis because it can be asked as a 3 marker for your final exams. We can do the following investigation. So your peripheral smear exam, all right, is one of the investigation we can do, and this will show two things. One is your macrocytic anemia, all right, and second, there are increase in your acanthocytes, all right. Now, second, there is an increase in your serum bilirubin. Thirdly, there is increase in your serum alkaline phosphate. Fourth, uh, the prothrombin time is prolonged, and the AG ratio is reversed. All right. Sixth is biopsy. So these are the 6 investigations you can do for liver cirrhosis. Coming to the complications. All right. So the first complication, which I'm sure you all would know, is your portal hypertension. All right. Second, hepatic encephalopathy. Now, because of this, the patient presents with confusion. All right. Thirdly, there is your hepatic renal syndrome. And lastly, there is a spontaneous bacterial peritonitis. All right. It's peritonitis, but to be more specific, it is spontaneous and bacterial. All right. So now we're done with almost everything of the liver cirrhosis. The last point I would like to talk about, the last heading, is your clinical features. Now, the reason I wanted to keep this in the last is because clinical features for your pathology are very important, because for the RS4 students and the RS4 questions, they ask questions, the 10, usually the 10 marker, and one of the 5 marker will be a clinical based question. So you have to know the clinical features for these important questions. So for cirrhosis of liver, the clinical features are: there is weakness, fatigue, and weight loss. Secondly, there's jaundice, all right, ascites, all right. Fourth is gynecomastia. Fifth is your testicular atrophy, all right. Sixth is portal hypertension. Seventh is splenomegaly. And eighth, all right, this is a very important one, it is spider angiomas on skin. All right. Now, uh, what are the spider angiomas? So this is your spider angioma. This is nothing but collection of abnormal blood vessels on skin surface. All right, so let's look at this question and understand what's happening here. All right, so there is a male, he's aged 52 years old, develops gradual weakness, anorexia, and weight loss. All right, he has ascites, splenomegaly, jaundice, spider angiomas, gynecomastia. All right, so these clinical features are coinciding with your liver cirrhosis. All right, so reading from this, we know this is your cirrhosis. All right, so we know what is the question and what answer we have to write. But let's try to understand what this part is saying. Over time, he developed behavior abnormalities and slipped into coma. All right, so this part, behavioral abnormality. So what is happening here? One of the complications we came across here was hepatic encephalopathy. All right, the patient presents with confusion. He has some neurological problem. All right, so that's what was happening here, and he slipped into coma. All right, then it says this history of alcoholism. So the etiology is alcohol, so it's alcoholic liver cirrhosis. All right, I hope you guys enjoyed the video, and that's it for today. Take care.